You're doing great. Here too. Hello. How are you? Hello. Welcome. How can I help you today? Oh, you heard about our new therapy? Yeah, we currently have a special treatment which is mesotherapy that we use in our face to improve certain areas that might be flawed. Let's say that you have dark circles, or you have areas where you have swollen abscess, maybe due to acne, or do you want to reduce the fat in your face? It's a very good option without surgery. We also have the vasectomy, which is the removal of the fat in our cheek area to make our faces look a little bit more slick and this area more prone to it. But with this mesotherapy, what we do is recreate that without surgery. Yeah, exactly. It doesn't last like a surgery will do, that is permanent, but it's a very good option for people that doesn't want to go through all the surgery issues. No, it doesn't have any downtime. Yeah, there is some swelling present, but we take care of it here in the office. So once you go outside, you look ready to go. Okay, so let me start by assessing your skin. Any areas in particular that you are concerned about? You're just looking for an overall improvement. Okay, so our special is 3 units of mesotherapy that can be done in face area and also the neck. In the neck area, it helps a lot with our little double chin that we tend to have. Normally it lasts around a couple of months, but let's remember that if we don't change our eating habits, all this fat is gonna return back. So it all depends on how you take care of it. If you are in a slimming regimen that you're continuing losing weight and you want to reduce your double chin, mesotherapy is going to help you greatly with that. Let's say it's a little boost up. But if you're not changing any eating habits and you're still doing the same as always, the fat is going to continue and come back because it's not a permanent solution. Yeah, because it comes back. Okay, so let's check your skin. Ooh, okay, I see that you're wearing something on. Foundation only? Okay. Let me just take care of that. Good. Okay, that's it. I think we removed everything. Oh, let's take a look. You have very beautiful skin, I must say. Okay. Can use a little bit here on the cheek area, just to highlight these bones here. I'm gonna apply a unit on this side just to make it a little bit more dramatic. Right here, I'm gonna be doing some markings, okay? Right there. Here too. Now I'm gonna ask you to raise your eyebrows like this. You have some fine lines of expression right here at the top that we can take care of it. It's not as button as with Botox. Botox completely eliminates it. But with mesotherapy, we give it a more natural looking here. So we can take care of these fine lines here. Okay. We can do some improvements in your jawline. Mark it a little bit more. Right here. This area too. Now I'm going to ask you to look up. Okay, this might tingle a little bit. Right here in your neck, we can improve it and do a little bit of work. So with the future, with age, it doesn't get that loose skin that we tend to have sometimes when you get old in our necks. So we can apply a bit on this area in particular. Right there. Okay, so now it's very important to do a little test beforehand. We might want to make sure that you are not allergic to the components, since it's the first time that you're going to be trying it, right? Okay, so let me show you how the needle is going to be. It's very, very small, as you can notice. You're barely going to feel it. We're going to be using 3 of this in all the areas of your face and neck. I'm sorry. You have a thing for needles? Oh no, don't worry. Don't worry at all. I know how it can be. We can apply a numbing solution that is gonna help you with that. Even though it doesn't hurt that much, it's like a little pick, pick, pick. But for some people, I understand that it can be even too much in that small of a needle. So don't worry. We have to do the test first. So we're going to be doing it in your arm. I'm going to numb it too, so you don't feel the needle, okay? Very well, so you're going to place your arm like that. And I'm going to clean the area. So first we're going to be applying the numbing solution. I'm going to leave it a minute for it to start working out. Yeah, don't worry, don't feel ashamed. It's completely normal, you know. I have a lot of clients that are truly afraid, that have a phobia for it. And we have another treatment with no needles involved. But for mesotherapy, we do need it. Okay, let's see. Okay, I'm going to touch you with this Let me know if you can feel it. Can you feel that? How about this? Excellent, you're ready. Okay, we're going to apply 0.1 unit of it. You ready? Okay, here we go. How did it go? Felt anything? You're good? Excellent. So let's give it a minute to see if there is any reaction to it. Okay. Yeah, normally start getting red. Let me know if you feel any itchiness, burning sensation. Nothing of that you should be feeling, okay? Yeah, let me know if any changes. Still doing good? Excellent. Okay, let's inspect it. Okay, there is no redness present, no burning sensation, no pain, tingles, anything like that. Okay, good. So let me just remove the lines that I did here. Actually, you can see right here in the side you have a mirror that you can check the lines that I did. Those are the areas that I'm going to be applying the mesotherapy. Yeah. I know it looks odd. You're okay with it? Excellent. So let me just take it off. Okay, so let's start by applying the numbing solution. Okay, now in your face, since it's more sensitive than the arm, you're gonna feel an odd sensation, like a tingling sensation. You're gonna feel a tingling sensation in your face, and then some warmth, and finally it's gonna start numbing. Just so you know, okay? You should be start to feeling it right now. Yeah, pretty weird. Let's give it a minute. Normally it takes a couple of minutes, but for some people it's almost immediately when they start feeling the sensation. You do? Okay. Now I'm gonna be touching you with this spoolie. Let me know if you can feel it. Nope. Nope. Okay. Good. It went pretty fast with you. Excellent. You're ready to go. So let's start with our first unit here. Just remember, it's not gonna hurt, okay? You ready? Okay. Start with your forehead area. It's quite fast, yeah. You don't feel it? Good. This is going to remove the fine lines of expression here. Good. You're doing great. Okay, let's do here. Okay, we are done with our first unit. Now, there's probably, you're gonna feel a little bit of like a tingling inside your skin. That is the mesotherapy working, okay? But you shouldn't feel any pain. Yeah? Very well. Let's go with the next one. Right here under your cheekbones. Make those cheekbones stand out. Yeah, sadly the best and only way to make it permanent is with surgery. Yeah, MESOTHERAPy, which is through the mouth. Yeah, it can be gruesome for some people. MESOTHERAPy is just the best alternative there is right now for it. Good. There is some swelling present, but we're going to take care of it in a minute. Okay, let's go with the third unit. This is for your chin and, your jawline and neck. I'm going to ask you to look up for me. Good. Now let's see your neck. Okay. Good. I'm gonna soothe the skin. I apply this cold compress into your skin, so it feels quite nice. Good. It feels a little bit cold. Yeah, but it's necessary. Good. Gonna do a little bit of roll off in your neck area. Okay, looking up, please. This helps with the blood flow. We don't want any bruises in the area. Okay, good. Very well, let's give it a minute. While I'm waiting on that, I'm gonna be prescribing you a solution that we're gonna be providing you with it. With this, you're gonna be applying it in the evenings just to prevent any bruising. Some people do bruise and this cream prevents it, other people don't, but we just send it to everyone. You're gonna be applying it at night, and it's a leave-in cream. You're gonna be applying your whole face and neck area. And don't worry, the instructions are right here. Okay. Yeah, it comes in forms of drops. The one that we're gonna be giving you, it's smaller, like this. It lasts you a week. It's a bit oily, but it gets absorbed by the skin. Applying your neck too. And then with it, you're gonna be doing a gentle massage. Very gentle, just as I'm doing it. Barely pressing the skin. We just want to make all these drops go through your whole face. Leave it for a bit. I'm gonna give you also a mesotherapy. This mesotherapy is gonna help with the swelling too. Right now has down, I will say 80%, but we wanna go down the 100%. Okay. So we did 3 complete units of it. That should go with a whole week. Oh wow, that's a great improvement already. Your skin is reacting quite well to the mesotherapy, especially on the fine lines at the top. Yeah, you can look. in front of your eyebrows like this. You can notice the difference. Yeah, the cheekbones is gonna take a little bit longer. Normally, by nighttime is when you're gonna start noticing the difference in your cheekbones, and it's gonna stay like that for a good 6 weeks. Yeah, and after that the cheek fat is gonna come back, yeah, like normal. The fat in our cheeks, we have a little bag of fat that is stored in there, and unless you remove it surgically, it's gonna be coming back depending on how your fat structure is in your face. Let's say if you haven't gained weight or lose weight and this is your normal type of skin, it's gonna stay like that. It's gonna come back. If you want to remove it completely, it's only via surgery. So just so you know, it's gonna come back, okay? Yeah, your cheekbones are gonna come back to its normal self. Okay, I think you're ready for the mist. Just clear it up. There we go. It's gonna feel quite nice. Put it in your neck area too. I tickle a little bit. There we go. That should do it. Okay, so we are done with your treatment. I would like to do a follow-up in case that you need a touch-up. Normally it's required after 3 weeks. It's in your package that you already paid. I would suggest you to come back for it, even though you notice that it's still nice and slick. Come back so we can do the touch-up, okay? Very important to take the drops. They're gonna be in the reception right here with my assistant. And let's say in 3 weeks I would like to see you again. If that's possible. We can give you well, yes, but the surgery that takes around half an hour to do, to remove the cheek fat back there. Yeah, for that kind of surgery there is a downtime of a few hours because you're gonna be swelling and might hurt a little bit to eat because the incision is right inside the cheek, in the mouth. It's pretty small, very, very small, the stitches that we do, but still can be difficult for some people. Okay, and then I will see you in 3 weeks. Please take care.